So all of this factor which is required as a professional need not to be of a higher standard that okay somebody could think that what I did is wrong because I should have followed the best procedure. I should have done 15 tests. But as a genuine or a thorough professional, for example, if you work in Delhi, it can be English or Hindi. But if you work, you need to have that regional language so that the patient understands that particular language. That in case tomorrow you have been questioned, you can take a difference that we actually taken informed consent for the patient.
It is a known fact that not every surgery or every treatment results in 100% success rates always. So, if a doctor has done all that he could and has used the best of his judgment, but still the procedure fails, what are the consequences in such cases?
So the consequences are of multifold. First is that, which is prima facie. For example, somebody went to a doctor complaining about his or her left leg, but the doctor amputed the right leg. That is something wherein there could be no discussion or deliberation. The court has held that okay, this is something which is wrong. Then comes the procedure is that during surgery there were certain reports, there were certain examinations which were carried out, which indicated that what kind of anesthesia we would give or in what quantity we would give, and then somehow the doctors did not realize that the position, for example, of a pregnant woman, they did not realize because so that's why the ecosystem needs to be trained. It is just that the doctor and the subordinates, the junior doctors, they need to be trained accordingly. Then supporting staff need to be trained accordingly. I think so. In multiple conversations we had today, they were referring to our trainings and trainings, and what challenges also we have seen is that there are certain individuals who are not qualified, but they have been trained to carry out the operations or the surgery or the procedures. Because they have been doing that for years, they assume that okay, this is the best person. So theoretically, it could be that a particular doctor who has 3 years of experience cannot do a better surgery than a person who is not qualified but has seen some kind of these procedures over the last period of 10 years. He or she can do it better, but the challenges is that he or she cannot do the procedure. The moment this kind of information is put on the report and that goes to the court, when the court asks what this person was doing when the procedure was happening and the surgery was happening, and when there is no explanation, this is where the court has held that the institution and the individual is to be liable. But there are instances wherein a doctor reasonably assumes that this is a procedure which is I am going to perform. He or she takes the consent from the patient that okay, we are going to try this and we are going to do this. This may result in something. This is something which wherein there could be complications. If I mean, of course, the patient has two options: either to withdraw that I am not going to go ahead with the procedure, let me die, or I mean, of course, there can be debate about whether I should be dying or not, but it is an option given to the patient that you can withdraw from the procedure, or you assume that tomorrow something happens, you assume that liability. In majority of the cases, what has been held that if the doctor has considered every reasonable restrictions or provision which he or she should consider and carries out that operation, and if there is minor negligence or there is a damage without any negligence by the doctors, it has been held that there is no medical negligence.
But what sort of legal journey do such cases face? Because doctors are usually worried that they will end up in, jail due to negligence. Is criminal liability a possibility?
Yes, so there are three kind of possibilities. One is civil, which is tort, and which also coincides with the consumer cases. Second is that criminality, where there is an intent of the doctors or the intent that a doctor should follow but did not follow. In that case, for example, when you go for example in this aesthetic kind of cases, when somebody represents you that I'm an expert in this, and a patient goes to that person and carries out that procedure, but it was required by the person to ensure that 10 particular steps were carried out. But what the doctor did is that he or she did not carry out 10 tests, he carried out some other tests or random tests, believing something to be true. So that is why, so I'll bring in the concept of what has been changing is that uh, when you hear most of the speakers and when you look at the technology, this is not the technology every doctor or every panel of doctors used to. So the technology is changing to an extent wherein before this is to the doctors that before you accept any particular technology, before you accept any particular instrument to be true, to be to the best of the knowledge that this actually works, needs to review all the results before you carry out actual procedure with the patients. Because tomorrow, if something happens, you cannot put the blame that okay, I did not knew about it. This is something which somebody sold, and so this is where somebody I'll bring some nuance to it is that I think you have also discussed about artificial intelligence. And so there are multiple challenges to it. Insofar as the legislation or regulations, if you would see, uh, in today's context, nothing has changed. The only piece of legislation which the doctors deal with is the telemedicine practice guidance 2020, which says that you can use AI only to assist. Of course, there have been instances where so AI could be forced that okay, you train them based on your information, based on the report you have. For example, you know exactly you have 1,000 information of your patient. So and you try uploading that to or train AI, but then the issue will come from the current legislation which is rules the and the DPDP Act. If the doctor has not taken consent from the patient to use those information to train AI, the answer is no, they cannot train it. Then you go opt for the ChatGPT or AI or ML which is available in the place. So what I see and what I read is that there are two kinds of results. First kind of result is that people have found out diagnosis or prognosis wherein they have consulted multiple doctors but have not come to a conclusion what kind of disease they have. And AI is able to assess them, but also there have been instances wherein people have been following the instructions from ChatGPT and they have gone, I mean, they have gotten diseases which were, I mean, eradicated from this world 30 years back. So this is something we need to be careful. But in my experience, I know that there are multiple companies. For example, you upload your face, photo of your face. They will identify, the AI will identify what kind of disease, disorder, or what kind of pigmentation you have, what kind of treatment you require. But the area is slowly developing. And then the factor which I would like to say here is that in 2020, the regulation evolved, the regulation devolved insofar as medical devices concerned. Pre 2020, there was only 23 medical devices which were regulated in this country. February 11, 2020, what the government did is that they came out with a notification saying that everything under the sun, instruments, machines, including the software, if it carries out certain procedures, it is going to be considered as a medical device and which is regulated. So now when I evaluate wellness clinic or aesthetic clinics, I see that do have the softwares wherein they put in the information, the information they do prognosis or diagnosis. Those would qualify or may qualify as a medical device. They need to test that as well.
Since we're speaking of negligence, so in cases of negligence and how clinics or hospitals are dealt with, what if the support staff like nurse, technician, or some other assistants well trained by the doctor have performed these procedures?
So in MC rules and specifically 2020 circular prohibits a doctor to train their staff to perform the surgery or the procedures. It is not that you can train your staff that okay, I have learned, now I am going to teach you how to do it. It is not the case. If I, for example, am a doctor, which wherein I have one, I have the educational qualification. Second, I have the training. Then I can pick up a similar doctor, maybe a junior doctor who have the same qualification or a similar qualification and training to carry out to carry out those functions. To that doctor, I can give that training that this is how we must do. But To the staffs only I could trend as to how they should support, nothing beyond it. If I mean in practice we do not follow this, it is assumed that a person who is diligent, a person who has been working in a particular clinical establishment, or in a particular establishment where these procedures are carried out, they tend to believe that a person who may not have qualification may have experience, but the law prohibits them. So if they do it tomorrow, they can be actioned under the NMC guidelines. So they're not supposed to train to the staff to an extent to carry out these surgeries or the procedures, but what they could train them as to how to support them. Supporting so on and so forth can be trained. For example, the staffs can be trained to explain the consent mechanism to the patient, wherein it would be required the presence of a doctor, because if the patient has some questions, it is the doctor who is supposed to carry out the explanations and all. But training should be limited only to assistance and nothing beyond.
Coming to the law now, since you mentioned, do you think there have been strict legislative measures for such irregularities in, the aesthetic procedure market?
Absolutely, I think so. There are multiple cases: failure of hair transplant, failure of liposuction, failure of surgeries wherein I think so permanent makeup we call, and so there have been cases. So I think so the only challenge, and I think so wherein we are also grappling with it, is if you look at a normal scenario, a patient has a problem, patient has a disease, he or she goes to the doctor, and there is a problem to solve. In aesthetics, I think so, apart from some of the cases, like for the last instance, acid attack cases, it is a problem wherein you would require a correction. But in majority of the cases, it is not a problem or a disease which would require definite correction. It is just that the correction or the options are available. You opt for it. You voluntarily opt for it. So there have started. There are very few of the cases which have started in the consumer forum wherein people have complained about, look how the doctors have promised us, look how the clinics have promised us, and look at the results. So when the results vary, so there could be some explanation that a doctor should give, that okay, we have explained this to you. The chances were that it is not 100%. This has to be there again in the consent form which we discussed. So in the past that there have been certain kind of, there have been no criminal cases so far in so far as the aesthetic procedure is concerned. Everything has been limited to fine, etc. But both civil and criminal consequences do exist in the country.
Any situations when, the courts have refused to entertain such claims of negligence?
Absolutely. So there have been many instances where the doctor were at no fault. The doctor explained the procedure to the patient. It is just that the patient had issues or the patient suffered from losses. The courts have clearly held that if the doctor, from a reasonable person, reasonable doctor's purview, have performed his or her duty, and have carried out the consent mechanism, carried out all the procedures which was required by any reasonable doctors to carry out the procedure. The courts have held that even if there is a complaint, it is still going to be no medical negligence cases. So those cases or those claims are rejected by the courts as well.
And how have compensations been granted by the courts?
So compensation have been fairly large and fairly small depending upon the kind of cases. There is no fixed formula for it. So it depends upon what kind of loss you have incurred. But I think so slowly and steadily we are moving to an extent wherein a patient or a consumer have to prove that the doctor was actually negligent in performing, and to clarify that these cases are equally tough. It is not simpliciter that I have faced a problem, I will go to the forum and the forum will accept it. The forum will review as to whether the standards which have been performed by the doctor do match with the standards of any reasonable doctor in that area or not. They are going to consider expert opinion. For in that case, the patient or the consumer also have to provide their stand of the claim, and in majority of the cases they fail to prove that okay, this is what the standards are, and the standards were not followed. Some of the example which come to my mind is that the patient do ask for the medical reports, the doctor do not provide, or the clinical establishment do not provide. The courts have held that this is serious medical negligence as well. So even if there is no damage, if you violate something, you will have to pay. So, but in still those cases, people do tend to claim amounts in crores and lakhs, but the courts tend to reduce it unless and until the consumers have actually proven their case. The consumers have consulted multiple doctors and have taken the view that okay, this is something which was standard. The doctors deviated from it, and then in those cases, the courts have held that the patient requires a good compensation.
On a closing note for all our doctors, aesthetic medicine practitioners sitting in this room, what would be your advice if they indeed wanted to venture into the field of aesthetic procedures?
Uh, so there are multiple do's and don'ts. You need to realize that you as a doctor would be held liable always. Your clinical establishment would be held liable, even if you are a great doctor. People come to you by knowing you, but you are not present in the premise. You did not carry out those procedures. You believe that somebody else will do. Of course, you do not promise that I will do, but you somehow believe that some person to whom you have trained, who may not be a doctor, or may be a doctor but not properly qualified or trained, please try to avoid that. Please try to ensure that you take proper consent from your patient. Spend time in explaining them, if possible, record it to ensure that even though at some point of time you get those cases do not succeed. And just do a research to see the kind of procedure you carried out, because I mean the example which comes to my mind is that I came across with a doctor who used to be a PCOD or similar kind of doctor. And what she realized is that her patient, who comes to her or who approaches her, do get tend to see hair fall. So then she started doing PRP. So then she started doing something which is like, okay, of course this is good, but the individual was not properly trained to carry out those procedures. Even though you believe that the patient comes to you, you have the trust of the patient, you need to ensure that if you do not have prerequisite qualification, if you do not have the experience, please have that person deal with it rather than you doing it and doing it wrong. You could be doing it, I mean, even though you do not have any qualification, you could still be doing right. The day it goes wrong, the day it complains, then the problem starts. Thank you so much.
Thank you. Thank you. A huge round of applause, please, for Mr. Biplab. Thank you for these insights and inputs. I'm sure there's a lot of conversation you can take off stage as well. But yes, with that, we come to the end of our last talk of the day. And I would like to present a token of gratitude to Mr. Biplab.